Okay, so this is an instrumentation tutorial. I'm going to run through all of the common surgical instruments that you're likely to encounter in the hospital for small animals during final year. And really, I'm going to try and go through all of the instruments that we might examine you on in both third year and final year. So we have this video, and we also have a PowerPoint presentation on Learn, which you can run through, which will get you to review some of this material and test yourself and give you a little bit more information about some of the elements. So between the two, we're going to cover everything that we're going to expect you to know. So this is one of our standard surgical packs. So you can see we've got this cage, which is autoclavable and contains all of our instruments that we'd use for general surgery. So I'm going to run through this first, and then we'll go through some additional instruments that we use commonly for a variety of common soft tissue and orthopedic procedures. So to open the pack, I'm just going to slide this little black slider across, lift the pack and unhook it from the side, and I'll pass that off to an assistant. And I've taken out a bit of kit from this just to sort of make it a little less busy for us to look at, but we've got all the elements in here that we'd have in our standard pack. So I'm going to start by taking out the two pots that we have here. So we have this blue pot, which is called a galley pot. The galley pot is used for detritus during surgery, so we're going to use that to put dirty swabs in, tissue samples, things like that. So we keep all of our rubbish contained within one area of the surgical field. So we're limiting contamination, so it's easy for us to subsequently come back and do things like count swabs, check that we have sufficient swabs. And then we've got a silver kidney dish named for its shape. And the kidney dish is what we're going to use to keep saline in during the procedure to ensure that tissues remain moist and don't get desiccated. And that's what we're going to soak our swabs in prior to use. So just before we move on, there's one check that we always must do when we're using any kind of autoclaved instrument. And on our packs, we put our autoclave markers on the bottom of the galley pot. So you can see this pack has been sterilized, and we've got a couple of things here which indicate this pack has been sterilized. We've got autoclave tape here. Now autoclave tape changes color when it reaches a set temperature, which is usually around about 121 degrees, something of that nature. So we know that this pack has been through a heat cycle. And we also have this sterilization strip, which does a similar thing. It has these two color markers here, which change color when the pack has reached these minimum criteria. So this is a little bit more reliable because not only does it tell us that the pack has been heated to a certain temperature, it also ensures that it's been heated for a minimum period of time. So you look at this one, which hasn't been autoclaved, you can see that the colors, the striped colors on the autoclave tape in the center haven't developed. And if we look at the sterilization strip, you can see these are at their pre-sterilization phase, so we know that this pack hasn't been autoclaved. So every time you open a surgical pack, regardless of what particular items that you're using to check the sterilization of that pack, whether you're just using autoclave tape, which is very common in general practice, whether or not you're using some autoclave strips like this, you should go through a quality control check those, ensure the pack is sterile. And the autoclave cycle hasn't worked properly and the equipment that you wish to use isn't sterile. So we'll take out these next. So we tend to use these, which we loosely refer to as being paper drapes. So we'll have a pack of 4 within each surgical pack, and then we may take additional drapes into the surgical field depending on what we are doing. And these open up for us to cover our patient with. And we also have a range of swabs in each pack. So our standard number of swabs is to have 20 swabs per surgical pack. You'll notice that these are swabs which have this marker running down this side. This is a radiographic marker, and that's really important for you to have in a surgical pack because this enables you to identify the swab should you leave it behind in your procedure in the patient's abdomen or chest, or in the soft tissues if you've been doing a reconstructive procedure. If you feel you may have left a swab in the patient, then you can x-ray the patient and see it, identify it easily by this radiographic marker. Lots of swabs don't have a radiographic marker, and it's a real mistake not to use them, particularly when you're doing things like abdominal surgery, because it's much, much easier to deal and resolve these problems if you can confidently say whether or not a swab has been left in place. So you can see these swabs open up to this sort of size. This would be a kind of fairly standard surgical swab for most procedures. And what we do with these swabs is we'll count them into our surgical field at the start of the procedure. So we'll check that we have the correct number of swabs for the pack, and at the end of the procedure we'll reverse that process again. We'll check that we are removing the same number of swabs as we've taken into the surgical field, as another safety check against leaving swabs behind. So most of our larger packs come with a cautery lead in them. So we use electrocautery a lot during surgery in the small animal hospital. This one is the one that we have as our sort of standard in our routine, and this is a bipolar cautery unit. So this has the cautery electrode attached to a pincer type or tweezer type handpiece, and we can gently grasp tissues between the jaws of this handpiece, and when we depress a foot pedal, we'll pass an electrical current from one jaw to the other jaw, and that will cauterize the tissues and achieve a coagulation. So we also have this. Now this is not a mistake. We do want a little bit of sponge in our surgical packs. So we have this little bit of sterilized sponge, and this is to retain our sharps. So we've got something like a needle that we finished with. We'll pop it into our surgical sponge, and that means that when we come to clear the pack, all of our sharps should be within the surgical sponge, and it means that the staff clearing the packs shouldn't risk needle stick injury or other injury with sharp implements. So it's very important that all of our sharps, all of our stray needles, scalpel blades, etc., as soon as we finish with them, we'll pop them in the sponge, and then we can just take this sponge and put that directly into a sharp spin at the end of the procedure. So I'm going to take these out next. So these are just a series of towel clips that we have in each pack. So we have 12 towel clips as our standard in a pack, which is quite a generous allowance of towel clips. But for the sort of procedures that we do, then we need at least that for the majority of procedures. So towel clips are designed just to pinch onto drapes so that we can attach drapes to the patient. So we'll take a close look at the towel clip. So towel clips do come in a variety of sizes and shapes and formats. This is the sort that we routinely use. So it's a ring-handled instrument. It has a ratchet, and it has these sharp pincer-type ends. And it's designed, if you imagine this is the patient's skin, this is a drape I've placed over the patient's skin. It's designed to be applied through a drape to grasp onto underlying skin to secure the drape to the underlying skin. So we'll take a closer look at the electrocautery unit that we have here. This is a bipolar electrocautery unit. You can see it has a handpiece which is very similar to a pair of thumb forceps or tissue forceps, and it's designed for just picking up tissue between the jaws. And what will happen is if you've got a bleeding vessel or something like of that nature you want to cauterize, you can just gently grasp the tip of the vessel between the blades of the handpiece here. And when you fire the device, which you do using a foot pedal, an electric current is passed down one blade, passes across between the two jaws, and returns back to the unit through the other blade. And what that does is focus that electric current through the tissues between the jaws of your handpiece, generates heat, coagulates protein, and achieves hemostasis at that point.